Good morning. This is Dr. Bill White again with the American Orthodontic Society, and I want to go through a case that I have shown you before, but I don't think people realize what a wonderful thing we get, the benefit that we get from palatal separation. I did not know this prior to this case right here, where this young lady torqued her own teeth, and I had her in round arch wires, and I pushed her front teeth out over, her upper front teeth out over the lower front teeth. Let me go ahead and show you the case here, and I think it has a virtue here that I have never known about palatal separation. And it is something, and I don't think people in general, I have never seen this written down and didn't know anybody that did this or knew about it. So here's a young lady who has, and she's class 3, she's got several other problems. She's missing a whole bunch of teeth. His upper and lower laterals, I think, are one of the main thing, and she's got a very thin upper lip and a deficiency right in the anterior part of the mouth, right in this area. You might could build I wish the lips came out a little more like that, but she's very nice looking young lady, just really nice. And here are her models, and she's got this problem that you see frequently, and people just don't realize this is brought about by mouth breathing and the tongue staying down in the lower arch, widening the lower arch out. And in this particular case, we've got a bilateral crossbite, you see, and the maxilla just is falling inside the lower arch. Now she has some class 3 genetics too, and they're never just totally one way or the other, and there's things going on here that we don't know, but we have to deal with the whole thing. And it's obvious we need to separate this palate. In other words, we're going to go in there and crack this palate apart and put these upper teeth out over these lower teeth, something like that. And when we go in with the palatal separator, that kind of forces the tongue down in the bottom arch and doesn't let it do much work up here. But when I took the thing off, watch what happened to the torque of these teeth. Now I worked off of the palatal separator and pushed these teeth forward over the lower teeth right here, which makes them kind of, they were pretty straight up like this, but after I got them over there, they were almost laying down. And then with a round arch in there, they came back later on with torque in the teeth. And that I have never read about or seen anybody that's done that. So I want to do this again and get people to realize the benefit that you get by expanding this palate. We soften this bone up in here, and when you get through, if you've got the person breathing right and functioning right, keeping the tongue up in this part of the mouth, you see, and if you breathe through the mouth, you're going to put your tongue down here. There's no way you can keep from it. So you've got to breathe through the nose to get this to happen. But when you do, and the tongue can stay up here, it widens the maxilla out. Now, watch this take place. I've got a bunch of pictures here. I don't have them organized the best way possible, but we're going to come in here and expand this palate. And the lower arch is a lot wider, and so our upper teeth are kind of fitting in here, you see, rather than fitting on the outside, locking it down. So just watch this take place. Now she's missing lower laterals and she's missing upper laterals. I think she's missing her wisdom teeth too, because we just depended on bridges and things to fill these gaps. Okay, here we go. We've separated the palate. We've got a palatal separator in there, and you see these upper teeth now are out over the lower teeth. So that they're not way out there, but they're over the lower teeth. So we've done a bunch of separation, and we pushed these teeth. We used the reverse headgear and pulled them forward and everything, and got the teeth out over the lower front teeth. But when you look at them cephalometrically, they look like they're laying down. Okay, I'm going to run through it. Here is the palatal separator. Now, man, we expanded this. I mean, it's way out there. And so these teeth now are out over, and we take this thing out, and we'll these two baby teeth right in here, I'm not sure whether they survived taking it out. They may have come out with it, the 6-year molar, and then we went on back and pushed out the second molar was pushed with it, but I didn't have it banded. Now here is a Hickam chin cup. It's a reverse pull headgear. Now this fits on the chin right here, and you bring these up and you go back and you got your palatal separator and you hook this to the palatal separator and it helps pull that out. I was trying to fill this part of the face out, but I didn't get all I wanted to out of it. And they throw their hair forward and they lay this strap in and they can put the hair back over, and you can fix this thing where it kind of goes behind the ears and they hardly see it. This is one of the easiest reverse headgears to get somebody to wear. But all they push back on the chin, which also goes up and works on the condyle that's sitting in the fossa up here. And it's some people with weak joints or that they're already back too far, you can't use this. And sometimes you can use it during the daytime when they keep their muscles pulling on, but at night when they relax, they'll go back and press into that retrodiscal tissue where the synovial fluid is formed, and it won't work. They just can't stand it in there. So this is a good reverse headgear though to use. And now this is looking from the front, and we got her to pull forward on that. And here in the mouth, we spread that palate out, and we got the teeth over the upper teeth over the lower teeth here. But I'm telling you, these, when you look at it in the cell, these teeth right here look like they're laying down. I mean, they've got so much torque in them, and you've got to reduce that torque. And so you want to bring the roots out here, but you don't want the crown to go back any further. So that is a hard thing to do. And it just did itself. I didn't even go into a rectangular wire to do this. And this is a marvelous thing in orthodontics. And I don't think people recognize that. So anyway, here we are. We've got just a round wire in there. That is a round wire. And it's a round wire on the bottom too. I hadn't gotten into the rectangular to start the reverse torque on those, and so I was going. Now here it is. We took the palatal separator out and took it off of these teeth and put this wire in, and look how those teeth are just laying up in the palate, but they're out over the lower teeth. See, now here she is looking pretty good. I've got a whole flock of pictures here, and I decided to use the cuspids as laterals up above, and so we'll bring them in and shape them up and everything. Well, I take that back. we push the cuspid back, and now I'm going to put a false or a plastic tooth in here, you see. And down on the bottom, we decided to bring the cuspid up and make it into a hefty lateral, and would put our artificial tooth or whatever, the bridge or implant or whatever she fills that in down on the bottom. But we'll wear a retainer with a tooth in this bottom part, and we wear a retainer with a tooth in this part right here. And I tell you, when you've got the tooth in the retainer, the people wear their retainers when they do that. If they break that. Now here we have a couple of plastic teeth up here, and you put them in, you put a bracket on it, put it up here. A lot of times the torque on a bracket will push the tail in, or the root part of this tooth. It'll kind of bury it up in the gum, and you can't tell it yourself. You have to look at it twice to see that this is not their tooth, you see. Now, okay, and there, now here we are. Here is where those teeth were when we pushed them out with a round wire, right here. You see the teeth out, and they're literally laying down in the palate up here. Now, this picture here is after we removed the palatal separator. The bone structure apparently was soft in here when we had pulled it apart, you see, and it was very pliable. That's the only sense that I can get out of this, what happened. But this is a virtue of palatal separation that I doubt if anybody has, and I did this a long time ago and have lectured on it through the years, but things like this just don't seem to catch on very quick. So I haven't seen anybody doing this. Now here the case comes back with this same round arch wire in there, and we're pushing this out to make room for those teeth to go in up here, and we've just got this round arch wire in there, but the teeth are torqued right now. Let me back up and you look at where they were, and here's where they came to. Correct function. In other words, she's breathing through her nose, and her tongue's fitting up in this area. That's why anybody's teeth are torqued properly up in here, as long as they're breathing through the nose. So there's a real virtue to breathing through the nose. I mean, there are all sorts of things are benefit to us. So when your child is not breathing properly, try to get him breathing, or him or her, properly, because it's going to make a lot of difference in the way the facial structure grows, the way the teeth grow, the way they fit properly over one another. And it's a very important thing to get the children functioning early on. And this is what I stress. Now, if you take people who don't mess with their teeth or don't try to correct something until they're 12 or 14 years old, this is utterly stupid to do that. You need to go in early and correct this. Now, whether it's nursing or whatever it is, it needs to be done early to keep the child developing a nasal airway. They cannot nurse and breathe through their mouth. And they should be, to me, that's something that's very important. The way the child starts up. And if you have something that's not going right, and you sit around and wait till they're 12 or 14 years old before you start your orthodontics, this is absolutely wrong. And this is something that I think pediatric dentists should be taught and should be doing. And if they can't do it, they know several big pediatric clinics that have 2 or 3 pediatric dentists. They hire an orthodontist to come in there. Now that's all right. But if you don't have somebody right there, you need to know how to do these things early on. And if you don't have an orthodontist, you're not going to ship this person, send them over for this and come back, back and forth, back and forth. They just won't do it. The pediatric dentist should be the one that does this, unless he has a big enough clinic that he can hire an orthodontist. And I know several clinics that do that. They don't want to learn the orthodontics, okay. But many pediatric dentists do learn it. And then for them to come along and condemn the pediatric dentist because he's doing orthodontics, this is another absolutely stupid thing that we're doing. And this is wrong. So I hope that we can get this corrected. And then let general dentists do simple, easy things. It's hard to pick out sometimes. All right, now here is a cephalometric picture of it. And this tooth is literally laying down. After I put the headgear in there and I put this chin cup and we pulled through here and pulled on the palatal separator, and then we put springs and pushed that in. But the central teeth are absolutely, look like they're laying down up here. Now look, and I have a round wire here, and there's a round wire in this picture. Look where the teeth went. Now, this is a self-torqued case. Why have we not recognized this? It just happened. And I got to looking at this stuff and saw what was taking place. I did not have any kind of torque in this wire that would make that tooth go out this way. And this was just not recognized. People didn't recognize this. And so I've come back and redone this video. And I want people to know what can be done. And it really ought to be something that's taught to pediatric dentists, and it ought to be taught to orthodontists. Everybody ought to know that palatal separation can actually soften up the palate up here, and you get the person breathing right and putting their tongue up in the roof of the mouth. It torques the teeth. That's why anybody that grows up and functions right has a certain amount of torque up there, and they're pretty much like this. So I hope that this will catch on and people will see what really can be done with this. Now I'm going to go ahead and finish. We put these false teeth up here, and we open the space down here, and we're going to make retainers that have this in there. And I'm not sure she's got any wisdom teeth in here. Let me go back and see if okay. Now we're finishing her up, but still she's got this real thin upper lip, and we've got her out there pretty good and got her teeth torqued good, but she has a deficiency right in this area of the face. Maybe you could put some of that material in the lip to thicken it up or something. A very pretty young lady though, and I've knew people that knew her after she grew up, you know. Now here we've got these false teeth. We'll put those on the retainer, and we'll build a lower retainer with a palette with acrylic pads in here, and when she gets mature enough to go in and do implants or bridges or whatever she wants to fill that in with, it can be done, but you have to hold it out. Now we've got these upper teeth where they meet over the lower teeth. And then we got her functioning correct. Alright, here's pictures of her. Let me run through this. I'm taking too much time. Well, I don't know, it's only a little over 20 minutes. And if you're interested in knowing something, you don't mind spending a little bit of time. If you're just thumbing through the catalog, I'm not too worried about you. But I want people to know how to do proper orthodontics. And you get this out there, and let me go through it. Here we are, we're torqued correctly, and I put her in the retainers, and we're going to leave her in this. Well, we haven't got the retainer on there yet. It looks like I've got some duplicates of pictures. This is her after we finished up with her. And there she is in the retainer. And these are false teeth on there. And if she breaks one of those off, she will sit in the office until you get it fixed. She's not about to go out, and they wear their retainer maybe more than they should. And there's the teeth torqued out, and there's where they were, and there's where they ended up. And I did not torque them. They torqued themselves. And this is something I have never seen anybody write anything about it or show it. But this was done. She was age 12 and a half here when this was finished up like this. And this is a good many years ago. Here she's age 9. She's missing these teeth, you see, so we moved the cuspids back and put laterals in here. And at this point, there's no, usually at 9 to 10, you'll see the wisdom teeth. Now these teeth at 9 or 10 should be down in here if they're 12-year molars. Now when I saw the young lady, she had some terrific cavities, so I sent her and got those filled, everything going. And now we took this and put the cuspid up here and put the artificial tooth behind the cuspid, so she'll have that done. That just you can make a decision on that yourself when you go to it. But she's 9 and almost 10 years old, and I don't see anything back here. And these should be way down here if they're 12-year molars. So these probably are wisdom teeth, and it's a tooth kind of in between a wisdom tooth and a 12-year molar. Comes in like that. And here we go with this, and she got the fillings, and we did it, and this just shows. Now this is 4 of 85, so this is not 85, and that's 15 and 18 years in here. This has been done several years, and I have yet to see somebody that's using this. Maybe I don't see everybody, of course. I talk to people, and they don't. People just don't seem to realize that teeth can torque themselves if you get the person functioning correctly. And that's a fact. And here we are. We've got the wraparound retainer. Nothing going across the occlusion on this. And let this come in. And when all those permanent teeth get in there and she gets older, you can go in and bridge this. But this is something every pediatric dentist ought to know how to do. And do it. If he doesn't do it, he ought to have an orthodontist right there in the building. I mean, right with him. Because you're not going to send this person back and forth to the orthodontist. So we need to change orthodontics and start doing what really should be done. And I don't want to be cross with people, but this ought to be changed. And okay, here that's my last picture I've got of her. It's a very attractive young lady, and you needed to get in there when she's young. Now you come in here after she's 14 years old, it just isn't going to be right. So I'm going to close it up, and we'll go on from here. Thank you a lot for watching. I hope you join our deal, and thank you very much. I'm going to say goodbye.